Okay, so let me quickly show the video.
Could you define the term epilepsy for me?
No, I don't think I can do that. No.
I don't know the exact definition.
The only thing I know about epilepsy is the strobe light sensitivity.
I feel like it has something to do with like a light or too much, something like that.
I just know that you forget stuff and you could have fell on your head.
I just know that it's where people become incapacitated. Generally, they can't respond very easily to questions and stuff like that.
They get to shaking and convulsing.
I just know that they have like a convulsion attack and then they fall on the floor and like there's really no way to stop it.
Basically, someone's body locks up and starts spazzing, and it has something to do with the nervous system.
I've never seen someone have a seizure, but I do know what a seizure is, yeah. It's when you have too much of your excitatory neurons firing.
Do you know what to do when someone has a seizure in your presence?
I don't know what to do personally. I do know to contact someone immediately, but as far as like the process, no.
Try to not let the person choke on their tongue, but I've heard, and I've also heard this kind of debunked. You put a spoon on their tongue.
Do I turn them to the side? I forget. I don't know.
Don't stick your hand into their mouth. Not trying to put them don't try to put a wallet in because they might bite their fingers.
I put a pillow under your head and wait for it to pass. I'm not sure. I don't know what I would do. I guess I would call somebody first.
If I had a seizure right here, what are the steps you would take?
Well, I don't know actually. I'd probably call help and try to, I don't know, shake you.
I wish I knew more about seizure first aid. I don't think I would know what to do if you had a seizure right now.
So as you can tell, our community doesn't know much about epilepsy, nor do they know how to help in the event if somebody were to have a seizure, which is why we have these trainings, okay? So we're going to go ahead and get started. The objectives for this evening is to know what epilepsy is, what the different seizures look like, how to administer first aid for each individual seizure type, when to recognize when a seizure is a medical emergency, because as we all already know, not all seizures require a 911 call. More often than not, a seizure will naturally end after 2 to 3 minutes and 911 is not necessary, but we will discuss when it is. We'll also identify correct and incorrect ways of helping someone during a seizure. So what is a seizure? Do we all know how the brain works? So in a nutshell, our brain consists of billions of cells, okay? Billions. These cells are all connected with each other. Think of our brain like a giant network of cells that are constantly communicating with each other via electrical messaging. This electrical messaging controls everything that we do. Controls speech, movement, it processes vision, it controls everything. But when these neurons misfire and send off too much electricity, that is what causes a seizure. A lot of people like to think of it like an electrical storm going off in your brain, just too much electricity being misfired at the same exact time. That electricity, depending on where it happens in the brain, it can alter movement because some people do convulse. It can alter sensation because some people's seizures are literally just a funny feeling in their stomach, and that's their seizure. For some people, it can alter behavior. They can act very odd or very strange during their seizure. And for some people, it can impact awareness, okay? It is very important to know that every brain has a potential to seize. Even if you've never had a seizure, you can have a seizure. People have seizures because they had a high fever, they overdrank one night, took the wrong medication, fell and hit their head. They could have possibly been dehydrated. There's many reasons why people can have a seizure, but it's not necessarily epilepsy. Those are just single seizures, okay? Not everyone who has a seizure has epilepsy. Anyone can have epilepsy, okay? Anyone, doesn't matter your race, gender, ethnicity, as long as you have a brain, you can have epilepsy. And so what is epilepsy? Anybody can have a seizure. But doctors don't diagnose somebody as having epilepsy until they have 2 or more unprovoked seizures. Keyword there is unprovoked, meaning you did not have that high fever, you did not take the wrong medication, you didn't overdo it on alcohol or drugs. The seizures just came out of the blue. Again, 2 or more, you will get diagnosed with epilepsy. The medical definition of epilepsy is the diagnosis of epilepsy indicates that a person is at risk for recurrent seizures. That is a definition. You will, every so often you'll hear the term seizure disorder. It's epilepsy. They're both the same exact thing. Okay. Is everyone clear what epilepsy is versus what seizures are? Epilepsy is a medical condition that causes seizures, but seizures can be caused by a number of things. If it's just once or twice in your life, it's not really epilepsy. These here are just some facts on epilepsy. About 3.4 million people here in the US have active seizures. Here in California, 400,000 people are affected. Here in the greater LA region, 160,000 people are affected. Here in the US, every day, 550 people are diagnosed with epilepsy, which totals about 200,000 annually. 1 in 10 people will experience a seizure in their lifetime, just a single seizure like we just discussed, whereas 1 in 26 will actually develop epilepsy in their lifetime. 1 in 26. Chances are very, very high. Odds are high. Epilepsy is very common. It's more common than CP, Parkinson's, MS, and muscular dystrophy combined. So it's a very common neurological disorder. Most seizures, despite how scary they may look, do not require a 911 call, are not medical emergencies and do not require a 911 call. Because like I said earlier, more often than not, that person's seizure will naturally end after 2 to 3 minutes and 911 is not necessary. People may not be aware that they're having a seizure, more than likely won't even remember what happened. Epilepsy is not contagious. It's not something you can catch from hugging someone or kissing someone, not contagious. It's also not a form of mental illness. People with epilepsy have a neurological condition, not psychiatric issues, okay? And almost never do people die or have brain damage from seizures. It does happen, but it is rare. It's rare. It's very important that a person get seizure control to minimize the risk, okay? And I'm gonna ask this question, even though I'm sure you know the answer, but how many of you here think you can swallow your tongue during a seizure? Okay, I don't see any reaction hands, so that's good. So yes, if it's impossible to swallow your tongue, so forget what your grandmother told you, your great aunt told you. It's physically impossible for you to swallow your tongue. It's attached to a very large muscle at the bottom of your mouth here, so making it impossible to swallow. Okay. Any questions so far? It's all been pretty basic. Remember, we're a small group. Just unmute if you need me to clarify anything or you have a question. So common causes of epilepsy. Unfortunately, and I say unfortunately because the number is so high, but in 60% of the cases, a doctor cannot explain to a parent why their child is seizing or a patient why they're seizing. Because a lot of the times the CT scans, PET scans, all those scans, they come back and they come back normal. There's nothing wrong with the brain. There's no tumor, no lesions, no scar tissue. There's nothing wrong. The brain is healthy. Yet for some reason or another, the cells are misfiring. Okay, 60% it is idiopathic epilepsy. It's the cause is unknown, but more and more through research, doctors are finding out that it's genetics. The genes mutate. There's a variant, and that's what's triggering seizures. Okay, but for the remaining 40% of identifiable causes, a person could have had some sort of brain trauma or head injury. They could have had, again, genes could have mutated. They could have inherited an epilepsy gene from their family. They could have had a stroke that led to injury, brain lesions, tumors, lead poisoning. They could have some sort of autoimmune disease, brain infection like encephalitis or meningitis, brain parasites, brain injury at birth. Sometimes when babies are being born, doctors use forceps to pull the baby out. Forceps can lead to injury, or sometimes the baby lacks oxygen and that can lead to injury. Or if the brain just doesn't develop normally, that too can lead to seizures. Anything hurting the brain, causing damage to the brain will more than likely lead to seizures, okay? So how is epilepsy diagnosed? A person has a seizure. They're more than likely going to end up in the emergency room. At the emergency room, they're going to give a referral to a neurologist. At the Epilepsy Foundation, we prefer that people get treated by an epileptologist, which is a neurologist that specializes only in epilepsy. Okay, an epileptologist. So once you're at the doctor's office, they're going to do a complete medical history. They're going to do a neurological exam, order some blood work, and then start the diagnosing. Typical testing for seizures is an EEG. I'm sure you all know what it looks like. It's like an EKG, but for the head. There's suction cups all throughout the head, and that kind of detects electrical activity in the brain. The most accurate testing, though, is the video telemetry, the video EEG, because you are admitted into the hospital for 3, 4, 5 days, depending. And the entire time that you're there, you're hooked up to an EEG and there's a camera on you. And doctors are doing whatever it takes to provoke a seizure. They are weaning you off your medication. They're not letting you sleep. They're hyperventilating you, flashing lights. They're doing whatever it takes to provoke a seizure because they want to know what they're working with. They can't diagnose you or treat you without knowing what they're working with. So a video telemetry is one of the most accurate. They also will sometimes, depending on the situation, order a CT scan, MRI scan, PET scan. And once the doctors get the results from all of these tests, they can identify what type of epilepsy you have and then best treat. Okay. Any questions? Okay. So we'll now go into the different seizure types. With epilepsy, there's more than 20 different types of seizures. More than 20, not just the convulsive ones that you think of. Okay, there's more than 20, but they're categorized into the 3, the focal, the generalized, and the unknown. Remember the electricity that I mentioned earlier that goes off in the brain, that misfires in the brain? In a focal seizure, only part of the brain is misfiring. Okay, only part of the brain is misfiring. And depending on where in the brain it's happening, that's what your symptom is going to be. Example, if you have a misfiring in your occipital lobe, more than likely your seizure symptom is going to somehow affect your vision. You might see stars, you might lose your peripheral, something's going to happen with your vision more than likely. So again, it depends on where in the brain it happens, that's what your symptoms are going to be. With the focal seizures, sometimes you're aware, sometimes your awareness is impaired. We will discuss the 2 different seizures in a bit. Then there's a generalized, where that electrical activity affects the entire brain. The entire brain is seizing. For that one, it's typically the absent seizures, the tonic-clonic seizures, the convulsive ones that you think of. And then lastly, it's the unknown, meaning that electrical activity starts so deep in the brain that doctors can't identify where it starts. So it's considered unknown. Yeah. In 2017, the International League Against Epilepsy reclassified all the seizures. So if you remember, they used to be called grand mal or petite mal or petit mal, whatever the old terminology was. It's now focal onset, whether it's aware or impaired awareness. And then you also have the generalized tonic-clonic. So as you can see, there's a long list of different types of seizures. Again, there's more than 20, but today we're only going to discuss the 4 most common. First being the absence. Has anyone here ever seen the absence seizure before? Araceli, do you want to share what you've seen?
Sure. My son currently has absence seizures.
Okay.
And his will present in a couple different ways. But one of the ways that it presents is that his eyes like come down to like, like he looks like a little, like Garfield. He looks very Garfield-ish. His eyes will do that. And then he'll just stand there like a blank stare, like nobody's home. And you can talk to him and, he won't answer.
For how long?
Usually about a minute, at the longest 2.
Are those maybe focal impaired awareness seizures? Only because they look alike. They look alike.
Yeah. Well, we have it. I don't know. The doctor he has never really spoke much of it. He just gave medication.
Okay. And it'd be interesting to know which ones he has, because these seizures only happen for a couple seconds.
Well, his depend, because his are triggered either by him being excited, him being too hot and overheating. So it depends. When he's like overheated, he'll come out of them, but he'll go back into them. So there'll be pauses in between.
Yeah, I know what you're saying. Okay. So he could be having absence. He could be having others. It's still not clear. But for those, thank you for sharing. Thank you very much for sharing. For those of you that have never seen this seizure, I will show you what it looks like. So we're all learning, right? I'm here in front of you. We're all learning about epilepsy. When all of a sudden, I'm sorry, Araceli, what did you say? I missed that. That is what the seizure looks like. Okay. When this seizure first starts, there is a pause in activity. Whatever it is that that person's doing, whether they're reading a book, drawing, having a conversation, eating, whatever it is that they're doing, they're going to stop doing it and they're going to start staring. During this seizure, there is a brief lapse of awareness. The person will not be able to respond to you. Depending on the person, they can either smack their lips or blink their eyes a little bit. This type of seizure is very easily missed because they only last for a few seconds. Literally, this seizure can be, and that's it, they're back with you. So they only last for a few seconds. This seizure is actually, teachers are the ones that catch a seizure more than parents, because parents just assume, oh my goodness, my kid's not listening to me. They're not listening to me, when in fact they are having seizures. Atypical absence seizures can last a little bit longer, but depending on the person or the child's seizure control, they can have hundreds of these a day, hundreds, which is a really poor quality of life. Because if you think about it, right now that we were talking and I spaced out, when I came back to, it was my job to piece together what I missed. So imagine a student who's learning, having to take chunks out of his life and having to piece all that together. Yeah, that it kind of sucks. It really sucks. So it's very important to get seizure control. This type of seizure, it can be confused with the person daydreaming, not paying attention, possibly being bored, or having attention deficit disorder because they can't focus. For this seizure, there is no first aid. Just monitoring how many times you see this seizure and making sure that neurologist, and of course keep the person safe, but making sure that information gets back to a neurologist. Okay. A quick question for you guys. How many of you would know how to differentiate between a child or a person daydreaming and a person having an absence seizure?
I think if I saw it happening, frequently, I'd be able to pick it up.
Frequency, okay.
If it just happened once, I don't think I would catch it in somebody.
They're very quick. They are very quick. So it's the awareness factor. That's the key there. It's the awareness factor. So if I'm, and when you daydream, you can fixate on something, but you're still fully aware, but your eyes are just stuck on something. If I'm staring at this sanitizer, right? This sanitizer here, and I'm staring at it and I just can't stop staring at it. And Victoria calls my name, I'm going to snap out of it and say, yes, Victoria, how can I help you? Whereas a person who's having a true absence seizure, you can be doing this to them. You can be tapping them on the shoulder, calling their name, dancing in front of them, and they have no idea that you are there. For those couple seconds, that person or child is disconnected and you can't get their attention. So it's the awareness factor. Okay. Any questions before I move on to a different seizure?
Does medication help reduce the frequency of these types of seizures?
Medication helps with all seizures, yeah. In 30% of the cases, medication won't be able to help people with epilepsy, but it's considered intractable epilepsy. But for the remaining 70, medication helps, yes. So we'll move on to the second seizure, and this is a generalized tonic-clonic seizure. This is the type of seizure that you think of when I say seizure, person falling over to the ground and convulsing, okay? When this seizure first starts, you will hear a loud yell. It sounds like the person's crying. It sounds like they're in pain, but they're not. What's happening is that there's air trapped in the vocal cords. And because the muscles are constricting, that air is getting pushed out. So sometimes you will hear a loud yell. The person will lose consciousness and possibly fall to the ground and start convulsing. Shallow breathing will definitely occur, but that is temporary. Once a seizure ends, normal breathing should resume. A lot of people assume, oh my goodness, they're not breathing, they're not breathing. If you listen closely, they're breathing. It's just very, very shallow. Drooling can also occur during the seizure because during the tonic-clonic seizures, people are producing excess saliva. And on top of the fact that they're not conscious, they're not going to know to swallow their saliva. So that saliva will be coming out. So you will see drooling. Some people do lose control of their bladder, their bowel. Not everyone does, but that some people do. And again, that's because the muscles are constricting. During the seizure, the muscles are very tight, very, very tight. Once a seizure ends, you know, a person's muscles relax and a person can urinate themselves or urinate themselves. And occasionally, because of the shallow breathing, the nails, the skin, the lips might turn a little bit blue. Does anyone know why?
I guess because, yeah, I know my mother had a lung disease and her extremities, her fingernails would turn blue when she wasn't getting enough oxygen.
It's definitely because of lack of oxygen, for
Yeah.
sure. So I'm going to give you a really quick brain fact. If you didn't already know, our brain is amazing. It's absolutely amazing. So what happens during a seizure is that the brain isn't getting enough oxygen. It's getting some oxygen, it's just not getting enough. And the brain goes into survival mode. So what it does is it knows that it needs oxygen to survive. So what does it do? It goes and it steals oxygen from the cells that have the most, and that is our skin. It's the brain robbing the skin of oxygen for it to survive. So that's why our skin turns blue. This type of seizure typically lasts about 2 to 3 minutes. May seem like forever for those of you that are not used to seeing them, but really it's just 2 to 3 minutes. And when the person comes out of the seizure, they're usually in a post-ictal phase where they are in a very confused state, very groggy, sleepy, tired. A lot of people may have headaches. A lot of people may vomit or feel nauseous. May have difficulty speaking. So it is very important that after somebody has a seizure that they get rest. One person might need 15, 20 minutes to sit in a chair. Another person might need 4 or 5 hours of sleep. Whatever it is that they need, just as long as they get rest, because after this seizure, they are exhausted. Exhausted. Okay. Some people I've heard takes them a week to recover. It just depends on the severity of the seizure. So first aid, what to do if you were to ever see this seizure. First and foremost, stay calm. I know it's easier said than done for those of you that are not used to seeing them, but please stay calm. If you panic, people around you will panic and it won't make for a good situation. So please count, breathe, do whatever it is that you have to do to keep your cool. If you panic, you won't be able to help that person, and that person really needs you. So please keep calm. Keep track of time. Any seizure lasting longer than 5 minutes is a medical emergency. 5 minutes is a magic number. 5 minutes is a general number. Everyone's epilepsy is different, but 5 minutes is a general number. Check for any medical IDs or bracelets or necklaces. That way you know that the person has a history of having seizure and it's not their first time. Keep the person safe. Protect them from any possible hazards. For example, if you have a person, say at the dinner table, if they're at the dinner table, move the table, move the chairs, basically just clear the area and make the area safe, because you don't want that person banging their arms and their legs and hurting themselves. So again, just clear the area, make them safe. Turn the person on his or her side once the seizure starts. Doesn't matter which side, just get their body and turn them on their side. Does anyone know why? There's 2 reasons you turn them on their side.
I mean, Probably could be like the excess saliva or the drooling or
Yes,
anything, any vomiting that might come up.
exactly. That's definitely one. So if you lay somebody, thank you, Araceli. If you lay somebody flat on their back, what's going to happen is that that person's going to be flat on their back. Can you guys hear me okay?
Yeah.
Okay, perfect. You lay somebody flat on their back, all that saliva that's being produced, or if they vomit, or if they happen to be eating at the time, is going to collect at the back of the throat. And when a person finishes having a seizure, they typically gasp for air. You'll hear a loud, they're gasping for air. So if you have a big puddle of saliva, a soda, a cheeseburger, whatever's in the back of the throat, they can possibly choke or aspirate. By turning them on their side, that allows for whatever is in the mouth to come out. So that's reason number one. Reason number two is the tongue. During a seizure, most of the muscles are being used. Most of the muscles are being used, except the tongue. For some reason, the tongue stays in a very relaxed state. So if you lay somebody flat on their back, their tongue being in the relaxed state that it is, it's going to go to the back of the throat. No, they are not going to swallow it, but it is going to block the airway and the person will not be able to breathe. By turning them on their side, that allows for the tongue to just kind of hang there, leaving the airway open. Okay, so it's very important to turn them on their side. If the person's on the floor, cushion their head. If you have like a scarf or a jacket, if you don't have anything, use your hands, cradle the head, protect their head because you don't want them banging their head on the floor. So just protect their head. Loosen any tight clothing, just make them comfortable. Stay with them until they're fully alert. Typically, I like to ask questions like, do you know who I am? Do you know what day it is? Do you know where you are? Ask whatever questions you want to ask so that you know that person's back with you. And let the person know that it's going to be okay, and call 911 if necessary. And by if necessary, I don't mean that the person had a seizure. Sometimes what happens is if you have a really tall person or a really heavy set person and they fall over and start seizing, they can crack their head, they can break an arm, dislocate a shoulder. So sometimes you're calling 911 not because of the seizure, but because of the injuries that the seizure caused. Does that make sense? Okay. Any questions about first aid? Okie dokie. A simpler way to remember first aid is stay safe side. Stay with the person, make sure to keep them safe, turn them on their side, and just continue to stay with them and make sure that they're safe. That's the easiest way to remember first aid. Stay safe side. Okay. So what not to do during the seizure? Never, ever, ever put anything in someone's mouth during a seizure. We have heard it all. Spoons, shoes, wallets, fingers, toys. Recently at Netflix, they were the last ones that shocked me. They told me screwdriver. I have heard it all. I've heard it all. Please don't put anything in someone's mouth. When a person has a seizure, they bite down and they bite down very hard. Okay, they clench very hard. Imagine if somebody jammed a metal spoon or a ruler in your mouth and you're grinding on that metal spoon for 2 to 3 minutes. What do you think is going to happen? You're either going to break your teeth or you're going to injure your jaw. One is very painful and one is very expensive. Do not put anything in the mouth. Yes, a person can bite their tongue. Yes, a person can bite the walls of their cheek, but that'll heal. And it'll heal quickly. Our mouth heals quicker than most parts of our body because of the amount of blood flow that goes through our mouth. Okay, so don't put anything in the mouth. Also, don't hold them down or restrain them. You holding them down is only going to injure them. Let them have the seizure. It'll naturally end on its own. Okay, so don't hold them down. Also, don't attempt to give them anything to eat or drink during the seizure. Remember that the person is not conscious. If you pop a pill in their mouth, they're probably going to choke on it. Wait until the person's fully alert before you give them anything to eat or drink. The only thing that you can give a person during a seizure is emergency medication, and that's only if it was prescribed by their doctor. Okay. Right now we have available on the market nasal sprays, buccal medication, rectal medication. So that's the only thing that you can give. So when to call for help? When do you call 911? You call 911 when it's a person's first time seizure. They have no history of ever having seizures. For that, you would call. If the seizures last longer than 5 minutes, like I said earlier, if the person is having seizure after seizure after seizure and is not regaining consciousness, or if the person has increased seizure activity, meaning that they're clustering. For example, if a person only has a history of having one seizure every 6 months, but one morning they happen to have 3 before noon, that's an emergency because they're clustering. So that requires a 911 visit or a 911 call. Also, if the seizures change in type, for example, if your son or your daughter has only ever had the absent seizure, the staring seizure, but one day they fall over and start convulsing, that's an emergency because that's not their typical seizure type. So for that, you would call. You would also call if the person is injured, like we discussed earlier, has diabetes or is pregnant. For those of you that have a pool or maybe take your kids a bath, if the seizure ever occurs in water, even if that person seems fine, call 911 because you never know if they aspirated any water. You need an evaluation, okay? Also, if normal breathing doesn't resume after the seizure ends, by then you would already start CPR, but yeah, for that you would call. And if the person themselves requests an evaluation, for that you would call as well. So we'll now move on to the third seizure type, and it's called the focal aware seizure, also known as simple partial, also known as aura. Anyone seen this seizure before?
No.
No? Okay. Let me show you what it looks like. This seizure comes in so many different symptoms, but I'll show you a few of them. So with this seizure, you do not lose consciousness. You're fully aware. You just can't control certain feelings or certain movements, okay, that are happening to you. So again, focal aware seizure, you are fully aware. So here we go. I am talking to you all about epilepsy again, and I'm fully alert when all of a sudden my hand starts to twitch. And I know that this is happening to me, and I'm trying to send signals from my brain to my arm, like stop twitching, but it won't stop twitching because there's a misfiring in this part of my brain that's causing my arm to twitch this way. And it's not going to stop until the misfiring stops. Okay. Twitching is just one symptom of this seizure. Again, awareness is maintained. You can still have a conversation with someone. They're fully aware. Some people do have rhythmic movements as their symptom, whether it's twitching of the arm, twitching of the legs, twitching of the face. No, I am not talking about when your eye flutters. Okay, I'm talking about full facial twitching. Some people have sensory symptoms, like they'll feel a tingling going up and down their arm or up and down their leg. Some people will feel very weak and tired out of the blue. Some people will hear things that are not there, smell things that are not there, taste things that are not there. Some people, it affects their stomach, like they'll feel butterflies in their stomach, or they'll feel really sharp pains in their tummy. For some people, it affects their vision, like they will see stars, or they will lose their peripheral, or they will lose sight altogether during this seizure. Some people have psychic symptoms like deja vu. They feel like they've already been or they've already experienced something. Some people can hallucinate or have an overwhelming feeling of fear that they can't explain. They're just scared and they don't know why. Some people get anxiety, again, out of the blue. The most common thing we hear is, it's a funny feeling that I can't explain. I know my body and it's kind of like an out of body experience. It's just a funny feeling is one of the most common things that we hear. This type of seizure lasts about 2 to 3 minutes, and it can be confused with the person acting out because they're scared. And a lot of times when a person is scared, they'll book it, they'll run because they're scared. Or having like a mystical experience because they're hearing things and seeing things. Okay. For this seizure, there is no first aid. Again, the person's fully alert and they're not going to put themselves in harm's way. They just can't control certain movement or certain movements, certain feelings. Yeah. Any questions about the seizure? So a few things about the seizure before I move on. How many of you have had a tingling in one of your limbs? Very common for you, for your arm or your leg to go numb. How many of you have had stomach pains? How many of you have had a headache or a migraine? So this seizure goes misdiagnosed like you have no idea. Misdiagnosed like crazy. If you go to the doctor and you say, hey, doctor, I have stomach pains, what are they going to do? They're going to send you to the gastro. If you tell the doctor, hi, I'm having like tingling, I'm constantly feeling tingling on my arm, they're probably going to send you to some kind of like doctor for neuropathy pain, right? Or if you tell the doctor, I'm seeing stars all the time, they're probably going to send you to the ophthalmologist. So there's a lot of, or hallucinations, a psychiatrist. So there's a lot of misdiagnosis with the seizure. And it's not until a person, and I hear this all the time, a person can go their entire life having these seizures and not realizing they're having seizures. They just accept it. They'll tell me, oh, I thought that was normal, but it happens to me all the time. And it's not until they had a convulsive type seizure that they realize that they've had these seizures all their life. So this seizure can be a seizure by itself, and then it goes away. Again, a misfiring in this part of the brain, and then it goes away. Or it can be what's called an aura, where that misfiring is like the warning. Whatever symptom that is, it's a warning that a bigger one is coming, meaning that that misfiring is starting in one part of the brain, and then it's secondarily, that electrical activity secondarily spreads throughout the entire brain and causes a convulsive type seizure. So it can be a seizure by itself, or it can be a seizure that is a precursor to another one happening, a bigger one happening, secondarily generalizes. Okay, any questions before I move on? All right. So the last seizure we're going to discuss, it's a focal impaired awareness seizure. This one's a focal aware. This is a focal impaired awareness seizure, also known as the complex partial seizure. Has anyone seen this one before? Okay. This one, I'm going to try to paint a picture. Imagine a teacher, and she has a classroom full of kids, and she tells everyone, read chapter 2. And they're all reading, very quiet, and they're reading. When all of a sudden a student gets up from his desk, starts wandering around the classroom, looking rather lost, confused, mumbling, not making sense. As he's walking up and down the aisles, he's rubbing his hands, not responsive to the teacher. The teacher can be saying, hey, Johnny, have a seat. Johnny, have a seat. Johnny has no idea that you're talking to him, okay? And Johnny can be going to the bookshelf, and because Johnny's in a very confused state, Johnny can be dropping things to the ground and again, not being responsive. I hope I painted that picture. It's kind of like, if you're familiar with the symptoms of sleepwalking, that's kind of what the seizure looks like, where the person looks like they're aware, but they're not. If you approach them and they look at you, they're not looking at you, they're looking through you. Like the lights are on, but nobody's home type deal. Hope I painted that picture. When this seizure first starts, the awareness is impaired. The person will not be able to respond to you. It often does begin with a blank look on the face, kind of like the absence, which is why a lot of people confuse the two seizures because of the blank look. But this seizure has automatisms. So any repetitive movement, if the person is sitting down, they can be rocking back and forth. They can be rubbing their eye excessively. They can be playing with their hair. They can be picking at their clothes. They can be rubbing their hands or rubbing their arm. So just any repetitive movements. The person will be clumsy, disoriented, aimless walking, no real direction, picking things up that they shouldn't be picking up, dropping things to the ground, mumbling, not making sense, smacking their lips like this, and possibly drooling. This type of seizure typically lasts about 2 to 3 minutes. And when the person comes out of the seizure, again, the post-ictal phase, they're usually very tired, have headaches, have nausea. So it is important that they get rest. This next bullet's important. May become combative if restrained. If Johnny is walking up and down the room and he's, at the bookshelf, dropping all the bookshelves, and the teacher just thinks, hey, Johnny's misbehaving, and let me get him to stop. And she says, hey, Johnny, stop. Out of natural reaction, because Johnny's in a very confused state, Johnny is going to look like Johnny's going to want to push her out of the way. Looks like he wants to fight her, but he doesn't. What's happening is that there's, again, he's in a very confused state and he's not understanding the restraint that you're giving him. Does that make sense? Okay. This type of seizure, it can be confused with this person either being drunk or high, because I swear to you, that's what it looks like, or having aggressive behavior if you try stopping them or getting in their space. Okay. Any questions about this seizure? Very common seizure. I'm going to show you really quickly what it looks like. What can it possibly look like?
Excuse me, sir, come on up and I'll ring you out. Come on, buddy, we're out of here at 5 on Sundays.
Okay. Did that, does anyone want to see that again? Okay. Well, that's one of the, that's typically what it looks like, but it comes again, everyone's epilepsy is different. So first aid for that seizure is to stay with the person. Very important to never leave the person alone because again, they're wandering. So it's very important to stay with the person. Speak calmly, keep track of time, always keep track of time, let others know what's happening, let them know that they are having a seizure and they're not just misbehaving. Check for any medical ID bracelets or necklaces. Do not repeat, do not restrain. I repeat, do not restrain. Gently guide them away from hazards. A lot of times, guiding them away from hazards is very easy. You get your hands and you build a wall. You guide them with your hands. They're not going to fight you. They're going to take the path of least resistance. So you guiding them away from the street is very important because a person can easily walk into traffic, not realizing what can happen to them. A person can fall down the staircase. So just guide them away from anywhere they can get hurt. Staircases, streets, stoves, pools, anywhere where they can get hurt. Just guide them away from any hazards. Sometimes if they're like in a classroom or if they're in a bedroom, sometimes all it takes is to shut the door and just let them wander around the room and they're going to be fine. Don't expect for the person to obey any verbal instructions because it's just not going to happen. And just stay with the person and continue to make sure that they're safe until they're fully alert. Again, ask whatever questions you want to ask, just as long as they're back, you know that they're back with you. Okay. So seizure triggers, very important to know that everyone's epilepsy is different. There are no two persons with epilepsy that are alike. Everyone's epilepsy is different. Some people have triggers, some people don't. And those that do, those triggers vary, okay? Let's talk about flashing lights first. Flashing lights is huge. Flashing lights affect people that don't even have epilepsy. So because it's a known fact that flashing lights trigger seizures, you now see warning labels pretty much everywhere. You see them on Disney, Netflix, Hulu, music videos, haunted houses, concerts, video games, anywhere where you're going to see flashing lights, you typically will see a warning label because there's something about flashing lights that triggers something in our brain to make us seize. But then now relating it back to epilepsy, you have people, it's a spectrum. You have people on one side of the spectrum who are very photosensitive that a picture can put them into a seizure. The glare of the pool, like the sun on the water, the reflection, that can put them into a seizure. The sunlight, I don't notice it and you probably don't notice it, but those fluorescent lighting, they flicker. That can put them into a seizure. So some people are very photosensitive. And then you have people on the opposite side who can stand in front of a strobe light all day long and they won't seize. They're not photosensitive at all. So it just depends. But other factors that can increase the likelihood of someone having a seizure in people who already have epilepsy, number one reason, they forget to take the medication or don't take it on time. That is the number one reason. Stress and anxiety can also do it. That's a huge trigger. Lack of sleep is another huge trigger. For females, hormonal changes, either right before, during, or after their menstrual cycle, the hormones can trigger a seizure. That is called catamenial epilepsy. If the person is sick, abusing alcohol or drugs, taking over-the-counter drugs like NyQuil or Sudafed, that can have an interaction with their seizure medication and trigger a seizure. The heat, especially in the summer, our people just drop like flies because the heat is a huge trigger. So if it is, make sure to stay hydrated, stay shaded, and if you can afford it, wear a cooling vest to keep your temperature down. So that's another big trigger. Malnourishment is also a big trigger. Loud noises, strong smells like smell of chemicals, that'll do it as well. This is just a short list. I think, or someone earlier, I want to say it was Araceli who mentioned it, that excitement can do it. And that is very true for a lot of kids, or excitement can trigger a seizure. Again, this is just a short list. Everyone's triggers are different. Some people have them, some people don't. So any questions about triggers? Okay. So treatment options for epilepsy. I think we're almost done. Treatment options for epilepsy. We unfortunately don't have a cure for epilepsy as of this morning. There are only treatment options available. First line of defense will always be medication. There's a long list of medications. Each medication has their own little baggie of side effects. Everywhere, anything from like people can become walking zombies, to weight gain, to hair loss, to aggression. It just depends, but there's a long list of medications available. The goal of treatment is to get the person on the right medication to stop their seizures with the least amount of side effects. That's the goal of treatment. There's also brain surgery. Brain surgery is also an option, but it's not an option for everyone. Remember the electrical activity that needs to start in one part of the brain. There needs to be a focal point. And if that focal point is in an area of the brain that isn't going to impact a person's quality of life, example, if they remove it, can the person walk again? Can the person talk again? Will it wipe out their memory? So there's a lot of testing that has to happen before a person undergoes brain surgery. But brain surgery has helped so many people. Just removing the part of the brain that's causing the seizures has helped tremendously for a lot of people. And also brain surgery is not what you think it was. It's not what it was 20 years ago. If you're familiar with laparoscopy surgery, that's what brain surgery is nowadays. They just kind of drill 4 little holes on the skull, and they go in with really thin wires, and the person goes home the next day. It's come a long way. Another treatment is devices. There's a vagus nerve stimulator. There's the RNS. There's a DBS. All of them, they're kind of 50-50. They help some, they don't help others. Does anyone want me to talk a little bit more about like the VNS, RNS? Okay, just know that these are options in case you haven't yet gained seizure control. There's also dietary therapies like the ketogenic diet. No, this is not the ketogenic diet that you see on social media. It is not pop keto. This is a true keto diet that is monitored very closely. You work very closely with the dietitian and your epileptologist and yourself to get to get results. And a lot of our kids are seizure free because of this diet. There's different models of this diet. One of them is a modified Atkins, where a person just limiting the amount of carbs and sugars at the intake has been also proven to help. Gene therapies is also a form of therapy. I can't yet wrap my head around the gene therapies yet, but I know that that's they're going in that direction. Doctors are going in that direction. So I can't really talk much about it because I haven't yet wrapped my head around that. But there's also lifestyle modifications, just managing your triggers. Example, if you know that you need 8 hours of sleep, don't go to the bar the night before. If you know that you can't drink alcohol, don't go to the bar the night before. Just changing your life to manage your triggers. Okay, avoid your triggers. And lastly, CBD. As you know, CBD is not yet FDA approved, and it's also not a miracle drug. It's not the miracle drug that social media portrays it to be. It's a drug just like any other drug. Might help, it might not. I always tell parents if they want to go this route, it's very important that they talk to their doctor first, because there's a lot of medications or some medications that can interact with CBD and trigger more seizures. So very important that they talk to the doctor. There is a CBD that is FDA approved, and it is called Epidiolex. That medication is right now only approved for people with severe epilepsies, like the Lennox-Gastaut and the Dravet. I'm crossing my fingers that it can be available to everyone at some point, but right now it's only available to the severe epilepsies. So, any questions about treatment? Okay. So it is very important to know what epilepsy is and how to help someone during a seizure. But it's also equally important to know that people with epilepsy live with challenges. It's not just them having the seizures. They have to deal with the unpredictability of seizures, which can cause a lot of anxiety. A lot of people have depression because they don't have work. Work discriminates, and then they don't have any money, and then they feel isolated. A lot of them can't drive, which impacts their employment. A lot of them have family stressors, caregiver stressors. Yeah, the list is pretty long, but it's not just the seizures. They deal with other comorbidities. So that is all I have to share for now. Any questions before we say good night?
I have a question.
Sure.
Yes, my name is Becky. I have an 11-year-old. Hi. I have an 11-year-old, and he's been taking carbamazepine since 2017, 18, 3 years now.
Mm-hmm.
But since he started the medication, he has not had any seizures yet.
Oh, good.
Yeah, so this year the doctor last year she was contemplating on taking him off the medication.
Mm-hmm.
And then I bargained for another year. So this year we did the brain activity.
The EEG? Uh-huh.
So I think I'll go back to get the results in January, much as we did it in August, but it's hard to get appointment. Yeah, so I was wondering, what do you have to say about getting off the medication?
So a lot of doctors will consider weaning a child or a person off medication when they realize that the medication has been working, but they do it very slowly, in the event that that person does seize. There is a chance that a person can go into a seizure. There's no guarantees, but there's always, if you want to give it a shot to see if your child can live without medication, seizure-free without medication, that's a conversation that you and your doctor should have. But it is very common for a doctor to do that after many years of not having seizures.
Okay, and I always hear after weaning them off, sometimes there's a chances of getting another like a bad seizure. So what do you have to say about that?
You might want to, if you are concerned about that, you might want to have the doctor prescribe an emergency medication. Right now, the latest and greatest is a nasal. I don't know if you guys can see that. It's a nasal spray that's available to people. So if you are afraid that your child you're in the weaning process and you're afraid that they might go into a seizure, just have them prescribe this just in case, so that you don't have to go to the doctor. Have a backup plan.
Okay.
Mm-hmm.
Okay. Thank you. Hi.
You're very welcome.
Hi. Thank you for your information. And
was that the same person?
My name? No, this is a different person.
Oh, okay.
My name is Pros. My daughter is Melissa, and everything you said, I live with it. She's nonverbal. So I've had to read, and it's good to add information. And just to comment that it's not an easy life, either for the kid or the parent. It's one of those life situations that are complicated. And I have gone through all the medications we are talking about. So I am kind of a referral point for whichever parent feels they want to ask questions. And I'm glad you are clear to say there is no miracle drug here. There is no miracle medicine because I've tried all the ones you have said.
And like I was telling Victoria, in 70% of people with epilepsy, people can gain seizure control or lessen the amount, but there is still the 30% of patients that are intractable. Doesn't matter if you've tried all of the drugs in all the different concoctions, there is still, the person will still continue to seize.
Yes, and that's me. We have intractable seizures. And right now, my biggest challenge definitely is caregivers to get like private ones even. And also the other challenge, I don't know whether you talked about it. I think every parent's dilemma for those who are learning afresh is the death, the sudden death, SUDEP.
Oh, SUDEP.
Yeah, it's every parent's dilemma. I mean, like every night I have to wake up to go and check. I mean, you live with that every day, wondering when is SUDEP coming.
No, don't. You're going to drive yourself crazy, Mom.
I know, right?
Yeah, do not. So just FYI, we are having a device for keeping safe with epilepsy, seizure safe, and we're going to be discussing a lot of devices. If you go on our website and our event calendar, you're going to see when it is. And if you are interested in joining and learning more about devices, we are going to be talking about it. But there are ways to prevent accidents from happening. If you'd like, I can send you, or I can send Victoria, and I think actually Victoria, I think I might have already sent it to you, I'm not sure, a packet of information, how to talk to your doctor, how to keep safe in a home, everything from like not sleeping with a pillow, not when you go to the bathroom, don't lock the doors, like things that we don't necessarily think about. But I can send you some information if it helps. And again, I can give it to Victoria, and Victoria can give it to you, or you can contact me, however you want to do this.
You did send that to me, Patty, and I'll put the link, I'll put that information, I'll send that out to everybody who registered. I know that some of you were not able to register, and so you were invited by a friend, and hopefully she can forward that information to you.
Yeah, it's a packet. It has like, I don't know, 20, 30 pages or something like that. The full-on packet. But yeah, you can get it from her, you can get it from me. But let's see if that was it. Oh, sorry, one last thing. I did want to let you guys know that the Epilepsy Foundation, we love partnering with organizations to get information out and to just educate our community in general. But this is what we do. We are a small nonprofit that's dedicated to helping people with epilepsy. We have a helpline where you can just call to get information, to get access to specialty care, because a lot of people don't think that they need to see an epileptologist when they really do. We do a lot of education. So we do workshops, we give these trainings at schools to keep our kids safe. We have topics every month, different workshop every month. We do advocacy both on a state and federal level. Right now, we're working on a bill to make sure that all of the schools in California are trained on seizure first aid. We also do supportive care programs, so everything from like camps to art therapy to support groups to college scholarships. I mean, we do a lot. We do a lot at the organization, with you guys in mind, with people who are families in mind. So
I put the link to your website in the chat box if anyone wants to click on that.
Thank you.
Well, thank you so much, Patricia. I know that you have to run because you have a class that you're
at Pierce College, yes.
Teach. So thank you. I'll follow up with everyone who registered, send out some information. And you can always, I'll put Patty's email address in the chat too, so you can follow up with her directly if you want to.
Or you can call me. Either one is fine. But everyone, have a good night. Thank you for joining us this evening. Thank you.
You as well. Thank you.
Thank you very much.
I hope this was helpful.
Oh, absolutely. Yeah, it's great. Thanks again.
Thank you. Have a good one. Bye-bye.
Okay, I'll put her email address right there if anyone wants it. So thanks everybody for joining us. I certainly found it interesting and I learned a lot, and I hope you did too. And again, if you know, I would encourage all of you to subscribe to the newsletter for the Family Focused Resource Center if you don't already. And I'll put our website in the chat box too. And there's a button right there on the main page that says sign up for the newsletter. So you can do that. And we have lots of good stuff. We're kind of slowing down now that it's December. We do have a workshop next week on the 8th, which is Wednesday morning at 10, called Fabulous Freebies. It's about free and low cost assistive technology. And that's on our calendar on our website if you want to sign up. And just wanted to say thank you all for being here. I hope it was interesting to you. So thanks again, and we'll see you next time. Good night.
Thank you. Good night.